Well, if you have sinus problems, you're not alone. The Mayo Clinic says that almost 40 million Americans experience sinusitis each year. That's a lot of people, but if the problem persists for too long, it could be a sign of something more serious.
Yeah, and then you may need more help than just simple home remedies. Dr. Madan Kandula and Julie Bartlett are here from Advanced Ear, Nose, and Throat Specialists, or ADVENT for short. We want to welcome you.
Thank you.
Last week on our show, Amy Taylor talked with you about something called balloon sinuplasty procedure. But this week we kind of want to talk about something that I guess could be called a blending of Western techniques as well as Eastern medical techniques, right?
Right,
so It's kind of a combination.
Exactly. And actually, like balloon sinuplasty, for instance, is sort of a step back from more aggressive surgery. So it's kind of going in the same wavelength as more Eastern philosophies. What we're trying to do with procedures nowadays is just optimize people's natural anatomy, get things open, get things working, and let their bodies do the rest.
Okay.
So why do you think it's important to take something from Eastern medicine instead of just focusing on what we know here in the West?
Well, you know, really, as far as problems go, people just want to get better. And, you know, by the least sort of invasive means possible. There's something called a neti pot, which I think we talked about a couple weeks ago, which is a great thing. It is an Eastern thing. It's been around for a long time. It helps a lot of people, and there's no reason why something as simple as that can't be put in the arsenal to help people.
And the neti pot is when you have a little remedy and you kind of put it through your nose and it kind of clears you all out.
It comes out the other end. Exactly. Yep.
Which is good. That's what a lot of the sprays are, right? Are just saline nose sprays. And how do you know in a case if a combination of these treatments is appropriate?
Well, you know, for instance, for my patients that I perform surgery on, every single one of them will be rinsing their nose out after surgery and before surgery oftentimes. So, you know, it's already something that I'm putting in play right now. And again, with the more minimally invasive procedures, it lets us combine some different things and help people out without having so much misery.
Julie, describe the work that you do, because you're a massage therapist. How does your expertise help sinus patients?
Yes, I'm a massage therapist at the Pallick Center at the Wheaton Franciscan Healthcare Elmbrook, and I do a specialized form of massage. It's a program called Sinus Ease that I've developed, and it's using this very light touch, circular, repetitive motion on the face and neck and upper chest and shoulders, and this actually softens the congested fluids that are in the nasal passages as well as in all of the face tissue, because it's oftentimes our lymphatic systems, and this is the system that houses our immune system, gets very sluggish. People don't exercise enough, they don't drink enough water, and so this is a way to help liquefy that again, and then this, with other things that we'll be presenting on a panel coming up shortly, help people get their sinuses back into a natural state.
Does it help relieve pain as well?
The treatment that I do definitely
massage?
helps. Yes, definitely helps reduce pain and go and help people get into a state of deep relaxation. And people are miserable when they have sinusitis and actually can't function well in their lives. And so this is an opportunity they can drop into that deep relaxing state, and the body can help heal itself during that state too.
That's interesting, bringing in massage therapy for your sinuses, and you're going to also be bringing in some other alternatives to help people out there with sinus problems at that panel discussion that you were talking about.
Exactly.
When is it and what's it all about?
It's on Tuesday, February 5th, and it's all about the reason that we brought this group of people together, this threesome together, is to let people know that they have choices in their health care. And actually people are demanding it more. They're demanding in a nice way, in a good way, to have more options. And so we're presenting the latest in sinus. Dr. Kandula is presenting the latest in sinus surgeries and care. And we're presenting, Pat Olin and myself are presenting the more holistic, traditionally holistic views. And so that's why we're
and you're
blending
it.
We're blending it together.
Which is somewhat unique,
We're not opponents. We're not this is bad and this is good. There's a place for each factor. And people, and I want to also let people know that it's not just for chronic conditions. This is a good daily health care thing to do at home, the neti pot and exercise and things like that. This is just another step of like brushing your teeth every day. And it's important hygiene practice.
Sure. Well, what's neat is people don't have to choose one way or the other. They could combine techniques to get the best overall results.
Exactly.
And do you feel like this acceptance of Eastern medicine and some of these alternatives is fairly recent in the medical community?
It is. You know, I think at the end of the day, we just want people to get better. And a lot of times the Eastern medicine techniques are really adopted for problems that we don't have great solutions to. And nowadays, you know, for instance, for sinus sufferers, we've got some new options, and I think that really lends itself well to kind of blending some new techniques.
What do you hope people take away from the panel discussion coming up on the 5th?
Well, really, what I want them to get is the full spectrum of options. And it really nowadays, with the things that I do, I've got a nice array of different things that would work, you know, for anybody who's having sinus trouble. You know, certainly with what Julie's got, and you know, there's lots of options out there, and it's just really tailoring that process to each patient.
Yeah, because I know you and I were both talking, this is the season for people to really be suffering with sinuses. I'm feeling it today, and it's nice to know that there are options out there. We want to make sure people know about the panel discussion that we've been talking about. It's Great Sinus Care, where East meets West, and again, it's Tuesday, February 5th. So that's next week on Tuesday from 6:30 to 7:45 at Wheaton Franciscan Healthcare. It costs just $8 to go, and I see a phone number there. You'd like people to pre-register.
Very much so.
For this discussion.
Yeah.
Okay, so give them a call and make sure you get your registration in and attend to get some great information about finding relief.
Absolutely. And for more information about what we talked about, you can also get more information on advent.md or give Advent a call at 414-771-6780. Thank you both of you for being here.
Thank you.
Yeah, thank you very much.
Well, still ahead on our